Today, we are going to talk about cranial cruciate ligament injury versus luxating patellas in dogs, including why they happen, how veterinarians tell them apart, and when medical or surgical treatment is needed. The cranial cruciate ligament, often called the CCL, stabilizes the dog's stifle, or knee, by preventing the tibia from sliding forward beneath the femur. Unlike a sudden athletic ACL tear in a person, canine CCL disease usually develops through gradual ligament degeneration. Genetics, limb conformation, obesity, poor conditioning, and age weaken the ligament until it partially or completely tears. The unstable joint then becomes inflamed, the meniscus may be damaged, and progressive osteoarthritis develops. Rottweilers, Newfoundlands, Labrador Retrievers, Mastiffs, Akitas, St. Bernards, Staffordshire Terriers, and Chesapeake Bay Retrievers have increased risk, although any dog can be affected. A luxating patella is different. The patella, or kneecap, normally glides within a groove in the femur. With patellar luxation, it slips toward the inside or outside of that groove. Most cases are developmental and involve abnormal alignment of the quadriceps, patella, patellar tendon, femur, and tibia rather than a single torn structure. Small breeds such as Chihuahuas, Yorkshire Terriers, Pomeranians, Boston Terriers, and miniature poodles are commonly affected, although large breeds can also develop it. A dog with a luxating patella often skips for several steps, extends or shakes the leg, and then suddenly walks normally again when the patella returns to its groove. A dog with CCL injury more often has persistent limping, difficulty rising, an abnormal sitting position, knee swelling, or a clicking sound caused by meniscal injury. Veterinarians diagnose patellar luxation by feeling the kneecap move out of position. CCL injury is identified using the cranial drawer and tibial thrust tests, sometimes with sedation, while radiographs evaluate arthritis and bone alignment. Non-surgical management may include weight reduction, controlled leash exercise, rehabilitation, and veterinarian-prescribed pain medication. Carprofen is one example of a prescription nonsteroidal anti-inflammatory drug. It reduces cyclooxygenase-mediated production of prostaglandins involved in pain and inflammation, but it does not reconnect a torn ligament or correct abnormal patellar alignment. NSAIDs can affect the stomach, kidneys, and liver and should never be combined with another NSAID or a corticosteroid unless specifically directed by a veterinarian. Surgery is generally recommended for significant CCL instability, especially in active or larger dogs. A tibial plateau leveling osteotomy, or TPLO, rotates the tibial plateau to neutralize forward tibial thrust. A tibial tuberosity advancement changes the pull of the quadriceps, while an extracapsular repair uses strong suture material outside the joint to provide temporary stability while scar tissue develops. Mild, painless patellar luxation may only require monitoring. Repeated skipping, pain, progressive lameness, or higher-grade luxation may require surgery. The surgeon may deepen the femoral groove, reposition the tibial crest to realign the patellar tendon, balance the surrounding soft tissues, or correct a severely curved femur or tibia. Neither condition is always preventable, but maintaining a lean body weight, providing consistent conditioning, avoiding sudden intense activity in an unconditioned dog, and addressing limping early may reduce joint stress. Dogs with developmental patellar luxation should not be bred because genetics may contribute to the condition. If you have topics you would like us to make content on next, or would like to donate to our video or game development, reach out to us at dogtoursgame or dogtoursgame@gmail.com.